All right, let's dive into some fascinating stuff today. The world of fluids and electrolytes.
Mhm.
The stuff that keeps our bodies running. And we've got some great material to work with.
Yeah, it's really incredible how much we depend on these things without even realizing it.
Right. From our cells to our muscles, it's all connected. We're looking at your lecture notes and quizzes from CNUR 203, by the way.
Oh, that's right.
So, whether you're studying for an exam or just curious about the human body, this is for you.
Definitely.
First, picture this. Our bodies are like these intricate water parks, right?
Oh, I like that analogy.
Yeah, with different zones or compartments where fluids hang out.
Exactly. You've got intracellular fluid inside our cells. Think of it like the VIP area.
Okay, makes sense.
Then there's extracellular fluid outside the cells, like the bustling main area. It has its own subcompartments, too.
Like intravascular fluid in our blood vessels, right?
Yep, and interstitial fluid between cells and organs.
Wow, so it's a whole network.
It is.
To really understand how it all works, we need to talk about osmolality.
Right, osmolality. It's basically a measure of how crowded a fluid is with molecules. Think of it like a party.
Okay, so the more crowded, the higher the osmolality.
Exactly. And water, it's like it always wants to go where the party's at. It moves towards the area with a higher concentration of solutes. That's osmosis.
So water is always chasing the action, so to speak.
It is.
And this movement across those semi-permeable cell membranes, that's driven by differences in osmotic pressure.
Right, and that's just one of the forces we're dealing with here. We've also got hydrostatic pressure. Think of it like water pushing against the walls of a pipe.
Okay, I'm visualizing it.
And then there's oncotic pressure, which is kind of like a magnet, drawing water in. It's driven by proteins that attract water and help regulate fluid balance.
So it's not just a free-for-all.
No, definitely not. These pressures work together constantly to maintain balance. It's pretty remarkable.
It really is.
These four pressures together are known as Starling forces. They act like a finely tuned system, ensuring that fluids move where they're needed most, whether that's out into the tissues or back into the bloodstream.
So what happens when those Starling forces get out of whack? Can you give us some real-world examples of fluid imbalances?
Sure. Think about dehydration, after a tough workout or being out in the sun too long. That's fluid volume deficit, or FVD. You're losing more fluid than you're taking in.
And in more severe cases, it can lead to hypovolemia.
Right, exactly. A serious condition where there's not enough blood volume to function properly. Then on the other side, we have fluid volume excess, or FVE.
Too much fluid hanging around.
Exactly. This can happen because of things like heart failure or kidney problems. The body struggles to get rid of the extra fluid.
You might see swelling in the legs or ankles.
Right. You could even have fluid build up in the lungs, making it hard to breathe.
It's all about finding that balance then.
Absolutely. That sweet spot between too much and too little.
Okay, so now let's zoom in on those tiny but mighty players, the electrolytes. They're crucial for maintaining this delicate balance.
Right. Electrolytes. These charged particles are like the electric current that keeps our bodies running.
We've got sodium, potassium, calcium, magnesium. They each play a vital role.
Let's break down what each one does. Sodium, for instance, is the most abundant agent in extracellular fluid. It regulates fluid balance and nerve impulses. Too much sodium, though, and you can run into problems like high blood pressure.
You always hear about watching your sodium intake these days.
A good reason. It's all about that balance.
Right.
Now, potassium, that's the most abundant cation inside our cells. Vital for muscle function, especially for the heart.
So low potassium, that's where those annoying muscle cramps after a workout come from.
Could be. If your potassium levels are low, you might experience weakness, even heart rhythm problems.
Oh, okay. What about calcium?
Calcium, crucial for strong bones and teeth, of course, but it also plays a role in muscle contractions and nerve signaling.
The multitasker of electrolytes.
It really is. And finally, magnesium, involved in over 300 enzymatic processes in the body. Muscle function, nerve transmission, blood sugar control, you name it.
So it's the unsung hero.
In a way, yes.
Okay, so these electrolytes, they're clearly essential for keeping our bodies running smoothly. How do healthcare providers actually check our electrolyte levels?
Usually with a blood test. They can measure the concentrations of different electrolytes in your blood and see if anything's off. Sometimes they'll also look at urine tests.
So it's like getting a snapshot of what's happening at a molecular level.
Exactly. By understanding these levels, healthcare providers get a better picture of your overall health and can catch potential problems early on.
That's amazing.
Yeah.
Okay, so we've covered the basics of fluids, electrolytes, and how they're measured. Now let's get into what happens when things go wrong.
All right, let's talk about those fluid imbalances. We mentioned dehydration earlier, but there are actually different types of fluid volume deficit depending on the cause and severity.
So it's not just about not drinking enough water.
Right. Imagine someone with severe diarrhea or vomiting. They're not only losing water, but also electrolytes like sodium and potassium. This can lead to isotonic fluid volume deficit.
Meaning what exactly?
The concentration of electrolytes in the blood might stay normal, but the overall volume is down.
So their blood is becoming more concentrated.
Exactly. And this is dangerous because it affects how wide the body can circulate blood. Now, you could also have someone who's sweating a lot, but only drinking plain water.
Oh, I see.
This can lead to hyponatremia, where the sodium concentration in the blood gets too low.
So in that case, they're diluting their blood with water, but not replacing the lost sodium.
Exactly. That can cause problems like muscle cramps, confusion, and even more serious issues like seizures or coma.
So it's important to replace not just fluids, but electrolytes too, especially when we're losing them.
Definitely.
Okay, we've talked about fluid volume deficit. What about fluid volume excess?
Fluid volume excess, it can also present in different ways, depending on the cause. Someone with heart failure, for example, might have trouble pumping blood effectively, leading to fluid buildup in the lungs and extremities. That's a form of hypervolemia, an excess of both water and sodium in the extracellular fluid.
So their heart isn't strong enough to keep things moving.
Exactly. It can cause shortness of breath, fatigue, and swelling. Then you have someone with kidney problems who might retain water and sodium.
Because their kidneys aren't filtering properly.
Right, and that can lead to a condition called dilutional hyponatremia. The sodium concentration drops because there's just too much water compared to sodium.
This is getting complex.
It is a delicate balancing act. The key takeaway here is that recognizing the signs and symptoms of these imbalances, understanding the causes, and getting medical attention can prevent serious problems.
Okay, great overview of fluid imbalances. Let's dive deeper into those electrolytes, starting with sodium. We know it's crucial for fluid balance and nerve impulses, but what happens when sodium levels go off the rails?
Well, when sodium levels in the blood drop below 135 millimole, that's hyponatremia.
Which can happen if someone's sweating a lot and only drinking water, right?
Right, but there are other causes too, like certain medications, hormonal imbalances, and even too much water intake in some cases.
Wait, you can drink too much water?
You can, believe it or not, especially if you're not replacing electrolytes. It's rare, but it can happen. Think endurance athletes or people with certain medical conditions.
So it's not just about how much you drink, but what you're drinking.
Exactly. And the symptoms of hyponatremia, they can range from fatigue and headache to confusion, seizures, and even coma.
Sounds like it can be really serious if it's not treated.
It can. That's why it's important to know the signs and get medical help if you experience any of them, especially if you've been sweating a lot or have any underlying medical conditions.
Okay, that's hyponatremia. What about when sodium levels go too high?
That's hypernatremia when sodium levels go above 145 millimole. Dehydration, too much salt intake, certain meds, hormonal imbalances, those can all be causes.
So it's not just about how much salt you're using.
Right. And just like with hyponatremia, the symptoms can be mild or severe.
What should people watch out for?
Well, early on, you might have excessive thirst, dry mouth, decreased urine output.
Okay, and as it progresses?
You might see agitation, restlessness, and even seizures or coma in severe cases.
Both sound pretty serious.
Absolutely. Understanding the causes, recognizing the symptoms, and getting medical attention is crucial.
All right, let's move on to another key player, potassium. It's essential for muscle function, especially for the heart. What are some real-world examples of potassium imbalances?
Let's start with hypokalemia. That's when potassium levels in the blood are below 3.5 millimole.
Okay.
This can be caused by medications like diuretics, gastrointestinal issues like vomiting or diarrhea, even excessive sweating.
So if you're on a diuretic, it's important to talk to your doctor about potassium intake, right?
Melodically. And as for symptoms, hypokalemia can cause muscle weakness, fatigue, constipation, and even heart rhythm problems.
Those muscle cramps after a workout, could those be a sign?
They could be, especially if you're not replenishing your electrolytes properly.
Now, what about when potassium levels get too high?
When potassium levels exceed 5.0 millimole, we have hyperkalemia. This is serious. It can lead to life-threatening heart rhythm problems.
So not something to take lightly.
Definitely not. Kidney disease is the most common cause. The kidneys are responsible for filtering potassium out of the blood, but meds, tissue damage, or even too much potassium intake can also cause it.
So if you have kidney problems, careful potassium management is key.
Absolutely. And it's important to remember that the symptoms can be subtle, so regular monitoring is crucial for at-risk individuals.
What should people be on the lookout for?
Early signs could include muscle weakness, fatigue, tingling sensations.
Okay.
As it progresses, you might see nausea, vomiting, and even irregular heartbeats. Severe cases, it can lead to cardiac arrest.
Wow, this is all making sense now. It's amazing how these tiny electrolytes have such a huge impact.
It is, and we've only just scratched the surface.
I know, right? There's so much more to explore when it comes to fluids, electrolytes, and how they affect our overall health.
Welcome back. We're diving deeper into the fascinating world of fluids and electrolytes.
I know, right? My brain is buzzing with all this new info.
Yeah.
It's crazy how these tiny particles play such a huge role in our health.
It really shows how connected everything is in our bodies and how crucial that delicate balance is.
Okay, so before we're talking about sodium and potassium imbalances, now let's move on to another key player, calcium.
Yeah, calcium.
It's not just about strong bones and teeth, right?
Right. Calcium is also super important for muscle function, transmitting those nerve signals, and even blood clotting. It's kind of like a master regulator in the body.
Okay, so what happens when calcium levels get out of whack? What should we be looking out for?
Well, if calcium levels dip too low, that's a condition called hypocalcemia. And it can show up in a bunch of different ways, like muscle cramps, tingling sensations, or even more serious stuff like seizures and heart rhythm problems.
Some people get those annoying muscle twitches or spasms. Could that be a calcium thing?
It definitely could be, especially if it happens a lot, or if you have other symptoms like fatigue, weakness, or numbness.
So what are some of the things that cause hypocalcemia?
Oh, there are quite a few things. It could be a vitamin D deficiency, because you need vitamin D to absorb calcium. Or it could be related to problems with the parathyroid glands, which they regulate calcium levels in the blood.
I vaguely remember learning about those glands in anatomy.
Yeah.
Didn't realize they were so important.
They're small but mighty. Hypocalcemia can also be caused by some medications, kidney disease, and even if you're not eating right.
So it's not just about getting enough calcium in your diet, but also making sure your body can actually use it.
Exactly. So if you're having any of those symptoms, it's really important to talk to your doctor. They can figure out what's causing it and recommend the right treatment.
Now, what about the flip side? When calcium levels are too high, what's that called?
That's hypercalcemia. And that can cause a whole other set of problems like fatigue, weakness, constipation, and even kidney stones.
So it's like your body slows down when there's too much calcium.
Yeah, kind of. It's like the brakes are on and things aren't moving as smoothly.
What causes that to happen?
Usually it's an overactive parathyroid gland, a condition called hyperparathyroidism, but certain cancers, medications, or even taking too many calcium supplements can also cause it.
It's a good reminder that more isn't always better, even with vitamins and minerals.
For sure, it's all about finding that sweet spot, that balance.
Right, right. Okay, let's move on to another important but often overlooked electrolyte, magnesium.
Magnesium, yes.
We talked about it a bit earlier, but I'd love to learn more about what it does.
Well, magnesium is a real multitasker, involved in over 300 enzymatic processes. It plays a role in muscle and nerve function, blood sugar control, blood pressure, and even energy production.
Wow, that's a lot. So what happens when magnesium levels get out of balance?
When they're too low, we call that hypomagnesemia. It can lead to muscle cramps, tremors, fatigue, and even seizures or heart rhythm problems in more severe cases.
I've heard of restless leg syndrome or those annoying eyelid twitches. Could those be related to magnesium?
Possibly, especially if you're also experiencing other symptoms like fatigue, irritability, or insomnia.
What causes hypomagnesemia?
It can be a number of things, like not getting enough in your diet, problems absorbing it, certain meds, or even drinking too much alcohol.
So it's a good idea to get your levels checked if you're experiencing any of those symptoms.
Definitely. Catching it early and treating it is really important for preventing more serious complications.
What about the opposite? What happens when magnesium levels are too high?
That's hypermagnesemia. It's not as common as hypomagnesemia, but it can still cause problems.
Like what?
You might experience nausea, vomiting, muscle weakness, low blood pressure, and in more severe cases, even slowed breathing or heart problems.
So it's like your body just starts shutting down.
Yeah, kind of. Your body goes into a super relaxed state, but too much relaxation can be dangerous.
Right, right. So what causes hypermagnesemia?
Usually it's kidney disease. You see, the kidneys filter magnesium out of the blood, so if they're not working properly, magnesium can build up. But it can also be caused by taking too many magnesium-containing meds or supplements.
Another reminder that too much of a good thing, even essential nutrients, can be a bad thing.
Definitely, moderation is key.
Okay, so we've covered a lot of ground on electrolytes. Now let's shift gears and talk about some of those other important components of our blood. Remember those red blood cells, hemoglobin, hematocrit, platelets, and white blood cells we talked about earlier?
Yes, those are all essential parts of a complete blood count, or CBC. They give us valuable insights into our overall health.
Okay, so let's start with red blood cells, or RBCs. They're the ones that carry oxygen throughout the body, right?
Right, they're like little delivery trucks transporting that vital oxygen to all our cells.
I like that.
And when we look at a CBC, we look at the RBC count, which tells us how many red blood cells are circulating, as well as the hemoglobin and hematocrit levels.
Okay, remind me, what's the difference between those?
Hemoglobin is the protein inside red blood cells that actually binds to oxygen, and hematocrit measures the percentage of red blood cells in the total blood volume.
Right.
If those levels are low, it could mean you have anemia.
Oh, yeah, anemia that can cause fatigue, weakness, shortness of breath, right?
Exactly. It's a common problem, especially for women and older adults. And there are many different types of anemia, each with its own causes and treatments.
So if you think you might have anemia, it's important to work with your doctor to figure out what kind it is and how to treat it.
Absolutely. Now let's move on to platelets. Those are tiny cell fragments that help with blood clotting.
They're like those first responders that rush to the scene of an injury.
Exactly. They stop bleeding and help with healing. On a CBC, we look at the platelet count. If it's too low, that's called thrombocytopenia, and it can increase your risk of bleeding.
And what if it's too high?
That's called thrombocytosis, and it can increase your risk of blood clots, which can be very dangerous.
So maintaining a healthy platelet count is important for overall health.
Absolutely. Now let's talk about white blood cells, or WBCs. Those are the soldiers of your immune system, always fighting off infections.
They're like our body's internal defense force.
Exactly. We look at the white blood cell count on a CBC. If the count is too high, that's called leukocytosis, and it often means you have an infection or inflammation somewhere.
And if it's too low?
That's called leukopenia, and it can make you more likely to get infections.
So the white blood cell count tells us a lot about the health of our immune system.
It does. And a CBC with differential can give us even more specific information about the different types of white blood cells, helping us pinpoint the cause of any abnormalities.
So we've covered red blood cells, platelets, and white blood cells. What about those other components, like hemoglobin and hematocrit?
We already talked about those when we were discussing red blood cells. Remember, hemoglobin is the protein inside red blood cells that binds to oxygen, and hematocrit is the percentage of red blood cells in the total blood volume.
Oh, right, of course.
Yeah.
So it seems like CBCs are a really useful tool for assessing our overall health.
They are. They give us a ton of information that can help healthcare providers diagnose and monitor all sorts of conditions.
Before we move on, I just want to touch on one more thing. Acid-base balance. Remember those ABGs or arterial blood gases we talked about before?
Yes, those are important for checking the pH of your blood, which tells us how acidic or alkaline it is.
And the normal range is 7.35 to 7.45.
Right. And like we discussed earlier, our bodies have these amazing systems for keeping that balance.
Buffer systems, the respiratory system, and the renal system.
Exactly. Buffer systems are like sponges, soaking up excess acid or base to keep the pH stable. The respiratory system helps regulate pH by controlling carbon dioxide levels.
And the renal system, the kidneys, are crucial for long-term pH regulation, right?
Right. They excrete or conserve bicarbonate to help maintain that balance.
It's like a perfectly orchestrated system, with each part playing its role to keep everything in harmony.
I like that, a finely tuned orchestra.
But when any of those systems get messed up, it can throw off the acid-base balance.
Exactly, leading to acidosis where the pH is too low or alkalosis where it's too high.
And that can be serious, right?
Oh yeah, it can affect everything from your heart and lungs to your brain and electrolytes.
So healthcare providers often monitor ABGs, especially in patients with certain health conditions.
Exactly, especially for people with respiratory or kidney diseases or those who are undergoing medical procedures.
It's incredible how hard our bodies work to keep everything running smoothly.
It really is. And it shows how important it is to listen to our bodies, see a doctor when we need to, and just make healthy choices to support these intricate systems.
All right, I think we've covered a lot of ground in this second part of our deep dive. We've gone deeper into calcium and magnesium, explored CBCs, and even touched on acid-base balance again.
We've only scratched the surface. There's always more to learn.
Stay tuned for the final part of our deep dive, where we'll wrap things up by talking about some practical ways to apply what we've learned.
We'll explore how understanding fluids, electrolytes, and acid-base balance can help us make healthier choices, manage chronic conditions, and just live better.
Welcome back to our deep dive. We've been exploring the complex world of fluids, electrolytes, and acid-base balance.
It's amazing, isn't it, how much we've learned about these crucial parts of our bodies and how they all work together.
I know, it's like we've unlocked some secret code to how our bodies function.
Exactly. And now that we have all this knowledge, we can actually use it in real-life situations.
Exactly, we've covered a lot of theory and science, but now let's talk about how it all applies to us. So what? How does all this information actually affect our lives?
Well, let's start with something as basic as staying hydrated. We all know we need to drink enough fluids, but understanding fluid balance can help us figure out how much we need individually.
Right, someone training for a marathon in the heat will need a lot more fluids than someone working at a desk in an air-conditioned office.
Exactly. And it's not just about how much you drink, but what you're drinking too. Remember, electrolytes. We lose them through sweat, urine, even breathing.
So that's why sports drinks have electrolytes, to replenish those lost during exercise.
Exactly. And even if you're not working out intensely, just adding a pinch of salt to your water or eating foods rich in electrolytes can be helpful.
Speaking of electrolytes, we talked about how sodium regulates fluid balance, but can also affect blood pressure.
Right. Too much sodium can make your body hold on to water, which can increase blood pressure, but getting enough potassium can actually help lower it.
So it's finding that balance, watching your sodium intake and making sure you're getting enough potassium from things like fruits, veggies, beans.
Exactly. And then there's calcium, important for bones and teeth, but also for muscle function, nerves, and blood clotting.
We talked about those conditions, hypocalcemia and hypercalcemia.
Right, those can be serious. It's important to make sure you're getting enough calcium and to be aware of anything that might be affecting your calcium levels, like medications or certain conditions.
And then we have magnesium, that often forgotten electrolyte.
Oh, magnesium is involved in so many processes in the body.
I know, it's like a little workhorse.
Muscle and nerve function, energy production, blood sugar control, even DNA synthesis.
Wow, that's impressive. So how can we make sure we're getting enough magnesium?
Leafy green vegetables, nuts and seeds, whole grains, even dark chocolate.
Dark chocolate, I can get behind that.
See, healthy eating doesn't have to
Yeah,
be
no.
boring.
Okay, so we've covered how understanding fluids and electrolytes can help us make healthier choices every day. But what about using this knowledge in healthcare?
Yeah, that's a great point. Understanding fluid and electrolyte balance is super important for nurses, doctors, and other healthcare providers.
Can you give us some specific examples of how they might use this knowledge in a hospital setting?
Sure, imagine a patient comes in severely dehydrated from vomiting or diarrhea.
Sounds serious.
It can be. Dehydration can lead to all sorts of problems, electrolyte imbalances, organ damage, even death if it gets bad enough.
Wow. So how do they treat someone like that?
Well, the first thing is to get those fluids and electrolytes back in balance. They might give them IV fluids with a specific mix of electrolytes tailored to the patient's needs.
So it's not just giving them water.
Right, it's about replacing those specific electrolytes that have been lost and monitoring those levels carefully to make sure they get back to normal.
Makes sense. What are some other examples? How else might they use this knowledge?
Well, think about someone with chronic kidney disease. Their kidneys might not be filtering out waste products and electrolytes properly.
Right, the kidneys play a crucial role in that.
Exactly. So healthcare providers might recommend diet changes, medications, or even dialysis to help manage those levels and prevent further complications.
It's incredible how understanding all of these systems helps them figure out the right treatment.
It really is, and it highlights how important this knowledge is for providing safe and effective patient care.
Okay, so we've talked about healthcare, but what about just for ourselves, even if we're not doctors or nurses?
Oh, absolutely. Understanding our own fluid, electrolyte, and acid-base balance can really empower us to take control of our health.
Hold on, I have a question. Let's say I'm feeling tired and having muscle cramps. Could that be an electrolyte issue? And if so, what can I do about it?
Great question. Fatigue and muscle cramps can definitely be signs of an electrolyte imbalance, but there could be other reasons too, like dehydration, overexertion, or stress.
So how do I know if it's electrolytes?
Well, pay attention to other symptoms, like if you're also really thirsty, have a headache, or notice changes in how much you're peeing. Those could be signs of dehydration, which often goes along with electrolyte imbalances.
Okay, so if I think it might be an electrolyte problem, what should I do?
The best thing to do is talk to your doctor. They can figure out what's going on and order any tests you might need.
And in the meantime, is there anything I can do myself to feel better?
Staying hydrated is always a good idea. And you can try eating foods and drinks that are rich in electrolytes, like fruits, vegetables, nuts, seeds, dairy products.
What about sports drinks?
Those can be helpful, especially if you've been sweating a lot. Just make sure to choose low sugar options because too much sugar can actually dehydrate you.
Good to know. So it sounds like being proactive and learning about our health can make a big difference.
Absolutely. When we understand how our bodies work and what the warning signs are, we can take charge of our health.
I think we've covered a lot in this deep dive, from the science to practical applications in everyday life, healthcare, and even on a personal level.
It's been quite a journey.
It has. It's amazing how these seemingly simple things, fluids and electrolytes, have such a huge impact on our well-being.
It is. And knowing that we have the knowledge and tools to make informed choices, that's empowering.
Exactly. And with that, I think it's time to wrap up our deep dive. We've covered a lot of information, but the learning doesn't have to end here.
Right, there's always more to explore and discover.
So stay curious, everyone. Keep yourselves hydrated and those electrolytes balanced. Until next time, this has been the Deep Dive.